Jovanovski Srceva. She's an associate professor at the University Clinic for Anesthesia and Intensive Care in Skopje, North Macedonia. I think she's on the call.
Yes, hi everybody.
There we go. Hi, Marija.
Hi. Good
Welcome
afternoon,
to
good morning, and good evening to everybody. I don't know who from where is. How are
Yep, we have people all over the place, so welcome, and we're excited for your lecture.
On your nice and well done things that you are doing.
Thank you.
I have to say that I'm really honored, and I'm happy to be here. So, as you said, can I start? Shelly, can I ask you first something?
Yeah.
Can we maybe unmute everybody so during the lecture I have to ask some questions, or maybe they will answer just on the chat, because
they've been answering on the chat. It seemed like when we had too many people unmuted, it was getting a little too, like, no one could hear each other because they were talking over.
Okay. I will ask you then when and what I need. Okay.
Yep, sounds good. And so Dr. Marija will be telling us a lot about how not just to take care of your patients, but also how to take care of yourself. So we'll get started.
Yes. So as Shelly said, I'm going to talk about today about the burnout syndrome. Next slide, please. I wanted to first. I have to say that I do not have any conflict of interest for this lecture. And why I want to talk about this burnout syndrome, because it's very painful. It's devastating for us and for everybody who is going on in the healthcare working system. We're going to talk about about the basic facts and what does the burnout means. Next, I'm going to tell you something how we can recognize and cope with it. And after all, next, please, we're gonna talk about that we have to be aware that today it's 2020. We live in some new reality. This is the new reality that exposes us to something new. Today we're gonna talk about how are we gonna get from tiredness to emotional exhaustion. Next. How easy we can get from I can do it all to get to the phase where you can say, I can't do it anymore. Or maybe, are we aware that maybe at some point, we as a health workers, as a students, and somebody who has to have empathy, we are crossing the line from empathy to pathophysiology. For instance, I can ask you, how many of you usually say, I cannot sleep, I have headaches, I have heartburn, I get sick all the time, I have allergies, start to suffocate, heart palpitation? I guess a lot of you. Anybody wants to participate, for instance? Okay. I usually do have these symptoms. So these are the symptoms that we usually as a doctors have it, and we usually don't pay too much attention to them. But next, please. There are yes. Next is that you wait up. No, please be back. Yes. After this, when you have your headaches or stress in your neck, you start to cry without a reason. You get sad. You're not concentrated. You get insecure. You start to panic at work. You start to be cynic. You have no more empathy. You are aware at this point that something is wrong, but you still do not do anything. This is the point where, next please, where you can be diagnosed with the burnout syndrome. Usually burnout syndrome means symptoms that describe emotional exhaustion. It means that you don't have any energy to finish the day. It means that you have depersonalization. First, in the past you were, for instance, laughing and you were socializing. Now you cannot socialize. You can even talk to your friends or even to your family. And you have low level of self-realization. It means that The first, when you got your fellowship or your residency, you said, okay, I'm gonna be the best, I'm gonna do everything, and now you don't even care about that. So burnout syndrome is a bomb. You have to be aware that it's a bomb that is always around us. It's a battle, and it's not a fair battle. Everybody can have it and everybody can lose it, for that matter. By the latest revision of the International Statistic Classification of the Diseases by the WHO, it was diagnosed with the Z73. So it's a reality and it happens. Next, please. What I want you to make some difference. Okay, yes. Who are groups that, or to make some differences? What are the groups at risks, and to make the essential differences between stress, chronic stress, and burnout? Groups at risk are health workers, anesthesiologists, intensivists, medical care nurses, ER staff, ER physician, ICU staff, surgeons, general practitioners, social workers, and students. I put the students at the end, but probably during this time, medical students can go on the first place. And what nowadays goes on, I cannot be sure whether there is not sufficient evidence-based medicine. Probably the COVID survivors, the population, who knows what else will COVID come, will give us to us, and how maybe probably in COVID survivors, the whole population, who else will go into the high risk groups? Can we go to, yes. The other name of the synonyms of burnout syndrome is academic flash dance, which means that usually people who have too much to work, too much to learn, they are too eager, they are too ambitious get them. The other synonym is adrenal failure, which means that some pathophysiology gets in here, and maybe we can call it the aftermath of the stress. Usually these are the synonyms that are used. Next, please. There are causes that are related to the burnout syndrome. Mainly causes are work-related. Some studies have said that probably how bigger and how huge your work amount is proportional to the burnout, but today it's known that it's not like that. What does your life causes? How do you treat your life? For instance, you are an introvert. You don't have people around you. You don't have too much friends. Maybe you're going through divorce, through some breakup, and something like that. And in the end, the personal traits can contribute to the burnout, which means that probably how you accept everything that's going on, and how your personally and psychological character stands in. Next. So I want to ask you, do you think that probably the stress is the same with burnout? Anybody? Do we have answers here, Shirley? And if no, what is the difference? No, yes.
Okay,
yes,
we got a no and a yes.
No. Okay, nice, not the same, yes.
Okay, can what's the difference, guys?
No, what is the difference?
Burnout is a sense of overwhelm.
Yes.
There we go. So with burnout, you can't cope anymore.
Okay.
Stress can be good stress or bad stress. Stress is a temporary thing. Can't cope anymore. Stress leads to burnout.
Okay, yes. There is no wrong answer. Be aware of that. Thank you for your cooperation. You know everything. Now I can go out from here. Burnout needs more recovery. Yeah, that is for sure. Stress is different from burnout, for sure. Everybody knows this. You see? Nice. Thank you for your collaboration. Stress is definitely different from the burnout, and the difference is for the stress you are you're aware of this. For the burnout, you are not aware of this. So let's go through what are the differences for the stress and for the burnout. Yes, you know, the stress is confusion created when our minds overrides the body's basic desire to choke the living daylights out of somebody. You desperately want to hit somebody, but you cannot. And usually the stress is caused by stressors. Can we go to the stressors? The stressors are situation, occasions, and or stimulation that mind recognizes as a threat at the moment. For instance, those stressors can be inner, external, or can be socialized. For instance, let me tell you how my day few days ago went on. My alarm didn't start. I was late for work a priori. I went to the shower. There was no hot water. For that matter, there was no showering gel. Then, when I finished showering, I tried to find my key cards, and I couldn't find them. Then finally, I found my key cards. I found that somebody blocked my car. Then I went into the car, and just near the clinics, just near the clinic, the traffic light went off, and I have to wait for the policeman to come for 15 minutes. As soon as I got to the clinic, my parking slot was occupied. And this doesn't stop here. This is just a good morning for how many stresses I have and how many external and internal stresses I had during this time. The day goes on. I went to my closet. It was broken. My sneakers was stolen. Two colleagues were COVID positive, so I have to take up the whole ER and high dependency ICU. At the moment, the power is out. All the alarms start to choke everywhere. The phone rings. The surgeon says, "I have to work with this and this and this and this and this." From the kindergarten, the teacher says, "Your child has my child had a temperature," and at the end of the day, my husband got fired. So in here you can see how many inner and outer stressors. The day and then the living is a stress. So these are the stresses, but this doesn't mean that I'm burnout. Can we have the next? Are we at risk? Yes, everybody is at risk, but we have to be aware that we have signs. Our body, mind, emotions, and behavior give us the signs. As long as everybody from who is student or health worker has signs from the body, mind, and emotion, it's okay. We're probably talking about stress and probably talking about chronic stress. As soon as the behavior comes and you change your behavior, you become cynic. You want to fight with everybody. You know you are the top of everybody. You want to know everybody, and you know everything. That is probably when you're going to the phase of burnout syndrome. Next, please. So there are phases in the burnout syndrome. The first is honeymoon phase, when you got when you got worked, when you employed, when you got employed, you got your PhD diploma, and this is honeymoon phase. You are in the ER, and now you think you are George Clooney. The second one is the reality phase. Your pink glasses starts to fall down. You see that the rumors are going on, that the work is not satisfactory as it should be. And the third phase is disappointment, where you realize that probably even you work too much, you're not very paid for what you're working. You get disappointed by the people, you get disappointed by the leadership and everything. And the last phase is alarm. So, as you said, many of you said, you go through stress, chronic stress, adoptional mechanism, and then to failure. Then you go to the burnout. There is a physiological part in explaining the burnout syndrome. Usually it's used the gas model of general adaptation syndrome, which is divided by three phases. And the first phase, please, Shelley. The first phase is when you first start to fight or flight. It's the first thing that you go through, and this is the pure adrenaline phase. In this, the stress is the answer to your no, to your knowledge. And at this phase, epinephrine and cortisol levels start to get higher. The second was is when you realize that you are under the stress, but still in here cortisol makes paradoxal turnover, because the main you're still under the stress, but instead of cortisol to go higher and higher, cortisol starts to get lower, to go lower, and at the end, when all your resources are grounded and reactions, you start to have reactions by the autonomic nervous system. The low level of cortisol is not appropriate at this time, but you still have, even though you have higher adenocorticotropic hormone. So this is how it has a physiology and pathophysiology. Going through the literature and going through everything, how you find burnout. Probably you as students in the USA, we don't have it here in Macedonia. For that matter, the Europe makes it, but we don't have it on a regular basis. You fill out the Maslach burnout inventory index, and it tells you at which part you are burnout. But this is a thing that I want to talk, and I need some interactions with you. So I would like some interaction with you. We have to be aware that today is the October 10th, 2020. Do you think that we forgot something about the burnout? And what did we forget about?
All right, guys, so the chat's open, so just type in the chat.
What more thing contributes to maybe this burnout, health workers burnout? Nice. Yep. 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 Yes.
There we go.
Mm-hmm. Nice. So actually everybody in here paranoia, everything nice. Pay more hours. Do maybe somebody feels that you're working and not paid enough for this, or maybe you were on the places that you're usually not competent to be on the places? Yes. So you see, with this, everybody, yes, of course. So we don't need the lecture. Everybody of us knows what are the causes and what are the things that go to lead us to burnout. But still, Pandora's box, yes, or the domino effects for sure. Shelly, can we go on? Yes. So yes, we definitely forgot the COVID-19 update. Can we go? Yeah. Nowadays, what I can say that maybe no go back. Yes. Nowadays I can say that maybe we forgot in the lecture that maybe the COVID will be the new or the aftermath of the COVID will be new synonym for burnout syndrome. Now we can go. Thank you. Going through the literature, where I wanted to see how the physicians incorporate with the COVID-19, we have to be aware that nowadays all the literature that we have for the COVID-19 is not evidence-based literature. It is usually done on a small part of groups. So it cannot be really in reality compared to what we know before this for burnout. This is a study done under on over 1,000 physicians worldwide, and what they have found, their psychological moment, what they have found that the intensive care unit specialists do have around 46.5% anxiety, 30% depression, and 51% burnout. Do you think that maybe this is the same percent that that was in the past? Do you think that this is a higher level or lower level for burnout? Seems worse now. Higher. So we generally think that it is a higher, yeah. Yes. Probably it's a higher, but still, I'm going to show you later on what the past says. And these are very controversial results. So we as a doctors, or we as a students and trainees or fellows, we feel the stress a little bit more because we are always torn between to treat the patient with the COVID, not to get infected, and somewhere between I have to go home and I have to be with my family. To us, it seems that we are a little bit more under the stress. When I was going also through the literature, the Thomas Kanampali was doing a study on over 300 trainees, for those who were exposed and not exposed to burnout syndrome. And what he has found, Shelley, is that the burnout syndrome and the stress, Shelley, can we just, yes, the burnout and the stress syndrome is higher in the exposed, which seems that the moment it's very logical. But there is some data, Shelley, please, that females are more prone to depression and anxiety during the COVID-19. Another study, the next study, that was done only for the psychological elements of the next, please, for the psychological elements of the COVID-19 pandemic, said that the most usual burnout that the frontline health professionals experience are emotional burnouts. Kelly, can you, Shelley, can you please? Yeah, thank you. Emotional. Usually they have somatic symptoms, and usually exhaustion is a part of a male, probably because they are male and they go working somewhere. Yes, and the symptoms are usually present in the nurses and in the trainees. So at this point, for the first question, we answered this question already. Do you think that the pandemic is a new course for burning out in health workers? I guess everybody will be yes. The second one that I want to ask, do you think that the percentage of the burnout health workers is higher in pandemics? I said that the results are controversial. I will show you later on. And now I want you to identify the reasons why the COVID is more is another factor, and just explain it like in simple words why it's why is the reason for being more stressed and stressed. Can we do that? Anybody idea? The fear of being infected, yes. Lack of social support, yes. Leadership, do you think that maybe leadership is here a problem? Personal equipment, People are afraid to be around me. The lack of social knowledge. Do you think that people who work from home have burnout? Yeah, yeah, yeah. Yes, yes. Thank you. Thank you. You know everything. I guess this lecture you didn't need this lecture. So thank you for interaction. Can we absolutely okay. Still, to understand the burnout and to understand maybe the COVID burnout, we have to understand the basics of the burnout. As I can see, everybody understands the basics for burnout. And the COVID burnout is not still evidence-based, and it's not still not worked. Can we go on the next slide? What I told you that before COVID, some data on a cohort basis show that even 25 to 50% of the surgical staff had burnout syndrome. And next, in 2016, burnout rates were up to 69 in the residents and specialists in the teaching hospitals. 70% were surgical residents and 66 were non-surgical. So if we try to compare this data to the data with COVID, we can see that probably during COVID, we as a health workers and students and everybody, we are not so much exposed to burnout, but still, this is not evidence-based. This is going just for not whole year. And we cannot say how much the aftermath of the COVID-19 will go on. So I wouldn't say that this is the real the reality and what it happens. So the answer to the question is, are the number of burnout health workers higher nowadays? They are not. Be aware that nowadays the health workers have their armed, have their suits, have their, they're like nothing can come up to me now, even though inside we are all fighting for that. So we have emotion, we are emotionally exhausted. Next, please. The World Health Organization and the Deutsche Welle said that probably this is a very unfair battle. This is unfair, and this probably will be demanding and will be divided in a new type of burnout, and it will be COVID-19 special burnout. So they're suggesting to the authorities to take always care for the medical persons, because you work face to face and you need a healthy doctors to treat the patients to become healthy. Next, please. So take care of your medical providers. Next, please. This is very interesting study, and this is a study has not been peer reviewed. Be aware of that. That is going under in over 600 countries and over 3,000 health workers. They were asked, why do they think, as I ask you, why do you think that usually you get burnout? And to explain the factors, what they have explained that there is discrepancy between work and home activities. They're what you have also said, that they are pushed beyond the competence. The exposure, whether you are exposed to COVID-19, the equipment, so you have all the answers before I did the lecture, all the equipment, personal protection equipment. What was very strange for me, what I found out that the high-income countries have reported higher burnout syndrome in health workers in difference to the low-income countries. This is probably because we, as a low-income country, we not to work without resources. This is my point of view. Next, please. So under the causes of burnout, which I said that they can be work, that can be personal trait, and then that can be lifestyle. Novel COVID-19 burnout syndrome are 6 to 7 factors. First, we have to be aware that it's a long-term time emergency. It's not just it's not the gear factor. Yes, it's not just uh, let's say earthquake or something that will happen in short time. So we need a long-term emergency planning. We have, as a doctors and students, protect our mental, spiritual, and mental well-being, become not just ourselves. We have to be aware about our colleagues. Next, the second thing that is mostly probably the factor is because we are exposing ourselves. And as somebody said, because of the gear, either we have gear, either we don't have gear, we are working face to face with patients who are COVID positive. We fight to give them a lot of nursing and a lot of health, but on the other side, we are afraid that we can get infected. Probably here, the answer might be a telemedicine. Next factor that contributes is that during these pandemics, people work outside their environment. They work in hospitals that are not their hospitals. They are working in not normal not normal environment. So probably because, and additionally, because they are not working or we are not working and we have our personal protection equipment, we do not have to time or to see that the exchange our knowledge with the research. Sometimes you can find yourself, you don't have internet because you're with all that gear, and you want to see what the studies had, but you don't have your phone, you don't have your iPad, you don't even have contact to internet. So probably making stations for contacting and finding stations in the COVID centers maybe will easier up our COVID and not to get to the COVID burnout syndrome as a novelty in this part. The fourth factor that is contributing is the as I said, the leadership communication, because usually during this time we do not have very supportive communication with the leadership. So in here, organizational leaders, coordinators for something might help us. The fifth factor that is contributing is probably and just losing your mental health. We have to be aware, wearing our closet, where we don't have to close ourselves in our closet. All of us are either anxious, either depressed, or we have to fight for the patient, but we don't want to fight even for us. On a weekly basis, we have to do some socialization. It doesn't matter. It can be on the Viber, it can be on social medias and something like that, because losing our going through isolation won't help us. And the last but the most is the increased number of hours. In here, we cannot work with so much increased number of hours. We need situation organization. Last but not least, all of these are meant for overall our health is our priority. Next, please. Next. So we have to protect. So we have to protect ourselves. We have to protect others. We have to treat patients, but we have to protect ourselves and be aware. This is a battle, but this is a battle that is not fair. Next, please. But we have to, even in the 2015, it was known that if the health personnel goes through burnout, the patient safety is under the question. So the authorities, the leadership, we, our colleagues, everybody has to fight for us we have to fight for us not to get to the burnout, so we can give adequate treatment for the patient. I'm not talking just for the COVID patients, for any kind of patients. Next, please. Next. But there is for this new reality, we said, okay, we have to give something more for the patients, but we have to be aware that burnout is somewhere between the doctors and the patient safety. But nowadays, we have a new reality which exposes also patients to this incredible thing, to novel reality that makes them even them burn out. So more and more patients on daily basis, it doesn't matter whether they are COVID positive or they are coming for surgery or for toothache or for anything, more and more patients will have burnout and will be more and more heavy to deal with. We will have problems to deal with. So this is also a thing that we have to be aware. We don't have time. We are burnout, but still we have a patient who will be more and more burnout and who will need more patience for us to get real treatment. Next. What I was going through, because we are always talking about the health workers burnout, we have somehow forgot the reality and forgot what's going on with the reality. Davida Ginter, she's CEO of non-governmental organization, wrote a book about burning out won't get you there. And she's talking about the whole population, not just health workers. And we have to be aware of this, because the employers, self-employed cannot work, or either have lost their works. They're unsure where and when this will stop. They're not sure how the new normal life will look like. And working from home, yes, as I ask you, takes its tolls. People who work from home are isolated, do not have the socialization, do not have face-to-face. We need a face, we need somebody to see somebody's eyes. So they're usually patients who will come who are not health workers will also come with some kind of burnout syndrome. Next. So we have a burnout. Let's say our patient has burnout. What we can do? Are we going to next, please? Are we going to probably bang our head here? No, the wall is not the hitting your head in the wall does not make you to become or to treat your burnout. Certainly, next, please. Certainly, next. Certainly, stuff like drugs or stuff like alcohol won't get us there. So we don't want in 2021 anonymous alcoholics meeting to look like a stadium full of everybody. So we have to find out a way to cope with this. Literature gives us some tips. Even in this time, even during COVID, you can do these tips. Next, please. Next. Working plan is one of the tips. You have to have a working plan when you go at work. Take your time. If you want to have a breakfast, have a breakfast. If you want to have a coffee, have a coffee. We have to learn how to use our resources. If this is too much for me, I won't do it. Our health is priority. Be creative. You can do puzzles. You can do writing. You can do singing. You can do drawing. Anything that you might think that it's creative. Upgrade in this way. More knowledge and more learning some new stuff makes you feel better. Seek for help if you really need it. And make new plans for unpleasant situations. And do sports, individual sports, and be aware, next please, that this Or next, or this is not a sport. So the burnout, as a conclusion, I can say the burnout is a fight. It's a not fair fight. It's out there. It's always staring us between our patients and ourselves. The burnout has no simple cause, and therefore there's not going to be a simple solution. Only if you are aware of that. Thank you for your attention. Does anybody have any questions or chats, or we can discuss for this?
Thank you, Dr. Marija. That was fantastic. Guys, the poll link is open for questions if you want to put any questions in or like other people's questions, because then it'll go to the top of the leaderboard and we'll answer them here, and you'll see them come up live on the presentation. So let me just put this in. I'll also put the link in the chat. There we go. So that's the link. Put in your web browser if you want to ask any questions.
So, yeah, everybody.
So thank you. That was great. How's Macedonia doing with the whole COVID situation? Oh, we got our first question.
Yes. Do you think burnout syndrome will improve in time?
That's a good question.
This is actually a very good question. I might answer like a politician with a question, but to be honest, I think that the burnout syndrome we have to divide the burnout syndrome for health workers against not against and the people over all over who are not health workers. I think that probably for the health workers they won't get they won't get on the good side. We will start to get more and more burnout, even though we are aware, because at this time and in the future we will wear, because we have to fight with this, we will wear our helmets. So when this is when this ends, probably that is where it's gonna have its peak. On the second, do many doctors go on antidepressants? Yes, if you go to the literature, the novel literature from this year and from COVID, the number of people who are on anti-anxiolytics or antidepressants are very high. But this is not just for the doctors, it's for the whole population. And probably the doctors at this time are trying to cope with what, because you cannot have, for instance, 100 days off, or you cannot have day off. Probably this is why you go on help from the medicine. Thank you for the question.
There's a couple more coming in.
Yeah. It's
like,
usually interesting. It's usually interesting thing, but just do you think that the introduction of artificial and more technology in medicine will help decrease? Yes, definitely. Introducing artificial intelligence, telemedicine, introducing exchange of the research will be the decreasing the stress for the doctors, because you can go apart from that face-to-face treatment. And then going through apart from face-to-face treatment, you can lower the number of people who are exposed, and they can change. So probably yes, high equipment and high intelligence equipment might help us here. Let us. You gonna read or I can read?
Actually, this one got cut off. So whoever put this question to deal with burnout, if you want to put it in the chat box or make it a shorter question, it was a little too long. It got cut off. I was like, I can't
Let me
actually
just,
find
maybe I can figure out to deal with the burnout is simply to love that you do, or otherwise you will crumble in the weight for our the question I would ask is how to deal. Nice question. I will repeat probably my lecture in this. How to deal? Be aware. Just be aware. We are all being aware, and just don't mix your chronic because even before the pandemics, we are always exposed. We are working as doctors with the vulnerable population. So be aware what's going on. The minute when you stop being aware, this is where the point where you get burnout.
Oh, this was it. How to deal with the mass panic during the COVID-19 time.
So how to do with the mass panic? You don't panic. Get cut off question. How to deal with the mass panic during the okay. How to deal? I don't know how to deal. Probably how to deal with the mass panic is education. The authorities and the leadership have to explain to everybody, because during this time while we are working we cannot explain. And for me instance, going out of work and meeting people who are working, let's say in banks, and I have to explain and explain and explain. That is not my job at the moment. My job is to take care of the patients. So probably more and more knowledge and more education will get you from that mass panic. And I think from going on, the mass panic will go down. Is it common for all the not teaching young ones while burning out? It's a very common problem in Macedonia. Please stay strong. We need you. Yes. Yeah. Thank you. Thank you for your support. Yeah. Do you think that doctors of general medicine should be more supportive mainly with the patient in isolation? Probably yes, but these general practitioners nowadays, I don't know how is going through the worldwide and how is in United States or in the UK. What I know that at this moment, general practitioners in our country have too much things to deal. First, they have to they have to deal with some administrative things, and then they have to check some checklists and do too much things. This is where the part of the question, can the telemedicine or the new equipment or the high-tech equipment help us? Yes, probably we can help us. So probably in here, you don't have to talk to everybody. You just go to telemedicine, you can see your patient, and everything is under control. In this way that is done in our country nowadays, I think that the first specialties that have burnout are the general practitioners.
All right, I think we have time for one more question. And
okay.
Will we get certificates? Yes, I will go over that during the break. I think that was more for me. We talked about general practitioners, the older doctors. When you have a lot of responsibilities and jobs to do, how do you stop the stress from overwhelming you? It is difficult to manage so many things and something.
Yes, this is a very good question. This is a question of what I was talking about during when I said from I can do all to I cannot do anything. You have to start and stop things, because at first you have your pink glasses and you think you can do anything. It is okay for you to say, I will fail here. It is very okay. I cannot do it. This is more adequate way to fight for yourself than to say, I can do it, and then you go in failure. You go in adrenal failure. So you have to fight for yourself. Even to your employer, you go and say, I'm a failure. I cannot do that. This is not your failure. It's your acceptance of what you really couldn't do. I know that too much things are expected for us, but just say it. Okay, I will fail here. I don't even care now. I have to fight for my health. It is okay to fail. Be aware of that.
That is the best advice you could definitely give. So thank you so much for being